My name is Dr. Brian Clay. Joined Illinois Bone and Joint Institute in the summer of 2015. My primary specialty is physical medicine and rehabilitation, or physiatry. Many times patients land in my clinic after having been told that they have a condition that's either incurable or non-operative and that they should just sort of bear the pain. However, oftentimes I find that just by taking a step back, reevaluating the clinical data, most importantly, listening to the patient, we can often determine the underlying root cause of the condition. And then by treating that through a tailored program, we're usually able to solve the problem and get the patients back functioning. Education is first and foremost one of the principles that I exercise in my clinic. My goal is to create an environment that fosters trust between the patient and the physician. I think that this helps to establish the diagnosis by optimizing that communication piece. Oftentimes, patients just want answers, and as clinicians, I think that it's our goal to be as clear to them as we can possibly be by explaining the condition and then walking them through A to Z how we manage and treat that condition. The ultimate goal for all of my patients essentially is restoration of function, optimization of quality of life. Whatever that looks like, whether that means playing 2 rounds of golf with friends, going for a leisurely stroll around the neighborhood without pain, that's where I find the most satisfaction. Our vision is steadily evolving. As medicine evolves, we were able to thrive in a rapidly changing market where you see a number of private practice groups being consolidated within hospital systems. IBJI has stood fast in our position that we want to maintain our autonomy to treat patients. As an organization, we are devoted to remaining cutting edge and to delivering the best possible care in this new and changing healthcare environment.